This is Dr. Craig Erickson. I'm the director of the Cincinnati Fragile X Research and Treatment Center. I'm here to briefly talk with you about COVID vaccines in the United States. So I had the opportunity in the last week. I was invited by the Indiana Department of Health, where I've had a medical license for over 17 years, to get the COVID vaccine, the first dose. And I quickly took the state of Indiana on their up on their timely offer, and I drove to rural Versailles, Indiana, where on a basketball court in an old arena, I got my first COVID vaccination. So I was very lucky. I received the Pfizer vaccine. My wife's a primary care physician at the University of Cincinnati, and a week before me, she received the Moderna Covid vaccine. In our minds, it really doesn't matter which one you get. Whichever one you can get soonest makes sense to get. And it's also important to remember that as of now, COVID vaccines are approved, the Moderna and the Pfizer, down to age 18 and older, so in adults. So I'm really encouraging you and your children to vaccinate as soon as a vaccine is available to you. So we have a lot of adult patients, many of whom live in group homes, who have gotten COVID-19, and some have had significant medical issues and required hospitalization. We've been lucky that we haven't had anyone die yet from COVID in our Fragile X patient group, but really on a risk-benefit analysis, the risk of COVID to our patient population, in particular persons with developmental disorders, is much higher than the risk of vaccination. So now I've got some resources up by state, and COVID vaccine distribution is different on a state-by-state basis. Kentucky and then Ohio and Indiana all have different approaches to distribution. I encourage you to, with the state you reside in, to contact your area, state, or county health departments, and be sure that if you have an adult, child with Fragile X or any other neurodevelopmental disorder, that they're properly listed and in position to get vaccinated when possible. In fact, Ohio specifically listed Fragile X syndrome in their phase 1B of vaccination, which should hopefully happen in the coming weeks. And it's important to remember your primary care doctors and our offices, we really don't have any near-term prospect of giving the COVID vaccine, that the county and state health departments are handling the distribution in coordination with medical centers often. So this is where I received my first vaccination, and where I'll receive my second in a few weeks at the Tyson Auditorium in rural Versailles, Indiana. And really, I think this has been a major medical accomplishment, the COVID vaccine program. We do science heavily in our Fragile X Center. We're working on new treatments in Fragile X. We know science, and this is excellent science. And really, whether it's a gym in Indiana, whether it's a hospital, whether it's any other location, really great science, and this major medical breakthrough is hopefully coming to you soon. And I really just encourage you to take the opportunity when you have it. We know that our patients with Fragile X and developmental disorders may be at greater risk of severe outcomes with COVID. And because of this, and just generally, it makes sense to get vaccinated. And we're hoping that our adult patients soon will have this opportunity. So now is really the time to make the decision to embrace the chance to get the vaccine when it's available to you. And I've set up an email that I'll be directly monitoring, Cincinnati neurodevelopmental@gmail.com, if you want to contact me and for any advice on working through the complicated process of aligning for COVID vaccination when it's available to you. So thank you for your time. Feel free to reach out.